It worked. It worked.
Jeff, this is Larry with Bobby Dot.
Very nice to meet you, Jeff.
So, just wanted to make that introduction. Jeff and I go way back.
Unfortunately, I go way back.
In a lot of different ways.
In a lot of different roles.
Oh yeah. Chuck Dunn,
Hey,
Jacob.
good to see you in person.
Can't be that long.
High school.
Yeah, you must have started very young.
As a child.
Exactly.
Yes, next week.
He interned.
Okay.
Right? All through college. So anyway, just wanted
Nice
to
to
make that
meet you.
face to face.
Appreciate it.
I think we're all will be. Or I will. I mean, I was planning to be there anyway. Hello. How are you?
Let me get in front of you so you don't twist your neck on
How are you, sir? No, not yet, Lee. Not yet.
Dark before work. Yeah, because we shouldn't, because we're second, and I don't necessarily want our thing.
I had it off and it just redid it. We've been having it.
Okay.
Turned it on. We go second, so they're not going to use it. Appreciate it.
I know that feeling. I know that feeling. I wish it could be but yeah, I got pushed everywhere, so you do that. Cheers. Yeah. I am. Apparently.
It's automatic login. Just click it. I'll come by and hook it up. But I feel like we're having trouble with this.
Yeah,
But that way it's off.
Yeah, he used one of those to turn it on.
I just don't like. We've been having issues with this all week.
You have a call. Me too. She is. Good. Yeah, me too. I think it gives him an opportunity to really expand what he's doing. Okay. Right. So we are federally and state funded. So about 95, 97% of my dollars come from the state. And we have a little grant from the state that allows us to work on a program that I'm talking about every day, inclusive post-secondary education. So we've got the dollars that go to us for that. But our job basically, we don't provide any service. Our job really is to be assistance change agent and capacity building analyst. Yes, exactly. Well, and in fact, Mark's program, and our program are related federally. We're both under the same umbrella. The Administration of Community Living, the Administration of Development Services. We're both funded through kind of that same stream of money. And along with GAO, Georgia Advocacy Office, and the Institute of Human Health and Disability. So, and our job basically is to be inside the state government.
Good afternoon. Good afternoon. Good to see all of you. Glad you're here. I know it's been a long week. We've got more to go, though, and this is one of the most important hearings I think that actually exists for this week, so I look forward to it. Thank y'all for making it a priority in your day. Before we get started, I want to let you know that we are going to do public comment time also at the end of this hearing. There is a sign-up sheet over there if there's anyone who would like to add your name and information to it so that you can share your concerns and your wisdom with us before we end. And now we'll get started. We'll begin the House Appropriation Human Resource Subcommittee hearing for today. And first up, and I want you to know also that you can choose whichever place you want to be, whether you want to be at the table or at the lectern there. So first up, we have Department of Veteran Services. Please come.
Madam Chair and committee members, good afternoon. With me today is our newest Assistant Commissioner, Mark Bannister. Dan Holt's elected to retire 30 days into the job, but he's doing a fine job for us. Behind me is Assistant Commissioner George Canavaggio, our Operations Director, Carrie Dye, and the lady that keeps us all straight, our budget analyst, Miss April Dodgen. Ma'am, in the sake of time, we won't go over everything, but we thank you for the opportunity today to come and discuss our FY 2020 appropriations for the Georgia Department of Veteran Service. Ma'am, on page 2 of your slide is just shows a flow chart of our department. Our staff is ready to do its part to continue to support our state's veterans. Your support through the amended and the operating budgets will make all this happen. Slide 2 is our organizational chart. We are using page 8 of the House tracking document. In our departmental administrative DVS 48.1 physical program at slide number 3, line 48.1, it reflects an adjustment of $723 for the agency premiums of the DOAS self-insurance programs. You slip over to slide number 4 is the Georgia Veterans Memorial Cemetery at line 48.2, contains the statewide across-the-board adjustments. Line 48.2-1 reflects an adjustment of $316 to the agency's premiums for DOAS self-insurance programs. The third physical program is at slide number 5. That is the Georgia War Veterans Homes, 48.3. The first reflects an adjustment of $58 to the agency's premiums for DOAS self-insurance programs. The second amendment is tracking 48.3.2, reduces the budget $777,724 in state and total funds to align the budget with the average patient daily census for the Georgia Veterans War Home in Augusta. The third amendment is tracking 48.3-3, reduces $183,864 in state and total funds to align the budget with the average daily patient census for the Georgia Veterans War Home in Milledgeville for a total of $961,530. In our budget planning, Madam Chair and Committee, we followed the Governor's guidance by reducing our operating budget 4% for FY 2020 and the additional 2% for FY 2021. The last physical program is at slide 6. It's Veterans Benefits, 48-4, contains only the statewide across-the-board adjustments. The first item at tracking 48-4-1 reflects an adjustment of $2,891 for the DOES premiums. The second item at 48-2-4-2 reflects reducing the funds for 9 vacant field service office positions. Our newly authorized positions, which included a 2-person office in Clayton and Fayette County, and also a 2-person office in North Forsyth, Fulton County, and 5 field service office positions in Atlanta VAMC, 1 in Cordele, 1 in Dalton, 1 in Evans, and 1 in Tifton. Under the FY 2020 amended budget, our recommendation was to freeze hiring for vacant field office positions totaling $398,995 in estimated salaries and benefits. Our additional recommended action was to freeze promotions for veterans benefits physical program in our field officers and appealed officers. These funds were generated internally by resignations and retirements of senior personnel in the field offices and an appeals division. Those funds wouldn't be distributed to other targeted skill level 1 GDS employees in the form of pay adjustments and or promotions, which will now be deferred until other funds become available. By freezing these adjustments and promotions, it is an estimated $157,213 will be saved in our budget, totaling $556,208 combined for both field operations and the appeals division. Slide 7 provides a department summary of the recommended amendment changes to our department's FY 2020 budget. The governor's recommended changes for the amended FY 2020 budget for our department will total a decrease in the amount of $1,513,808. The amended state general funds will total $21,987,000. The projected changes to the federal and other portions of the budget be reduced by $1,513,000. This brings our total funding from all sources to $39,832.35. Ma'am, this concludes our briefing.
Excellent. Are there any questions from the committee members or comments? Okay. Let's see. Representative Oliver.
I've gotten a little confused up here, forgive me, but I'm
Yes,
looking at the budget book,
Yes, ma'am.
and it's showing reductions in savings from nursing home facilities of 700 based on average daily patient census. How many beds are filled at this point in each of your facilities?
Okay, Mark's going to get that information, ma'am.
Okay.
Good afternoon, ma'am. Representative. Currently, we have 143 beds that are filled in Augusta and 219 in Milledgeville. And with those totals, there are 362 for both homes.
And what's your capacity?
Capacity, it is 249 for Augusta, excuse me, and for Milledgeville, and I had that number too. 197, that's right, 197 for Milledgeville. I'm sorry.
I'm trying to figure out if your capacity is down from last year. It sounds like it's down from last year.
Yes, ma'am, it is down.
Is that intentional, or is that based on people asking for beds?
It's people asking for beds.
So you don't have people asking for beds, and you have empty beds?
We do have a current waiting list, and it's just because we have our caretaker, Pruitt Healthcare, is currently managing our Milledgeville, and we have asked them to just suspend admissions right now while they're going through an administrative kind of program themselves to make sure that they're providing the best health care that they can for the folks in Milledgeville. But there is a hold in admissions right now.
So maybe your budget lady can tell me how your bed usage has gone down the last maybe year or two, so we can see where we are. Thank you very much.
Yes, ma'am.
Yeah, just to be clear, how long has that hold been from, and it came as a request from Pruitt?
Came from request from us.
Ma'am, what happened was the VA Medical Center in Dublin came down and inspected, and they found a couple of tags, and they're correcting those tags. A deficiency, if you would. We had falls, and the falls were increasing, and it was due to lack of personnel. They had a shortage of staff, so we met with Mr. Pruitt, Neil Pruitt himself, and his senior leadership, and that was 3 weeks ago, ma'am. We're going to meet. We have a meeting with them on the 7th of February, at which time they should have their action plan in place, and once the VAMC gives us the go, we will take that freeze off.
So it's a hold.
Yes, ma'am. It's a hold right now. Yes,
Because
ma'am.
the VA, I mean Pruitt, but the VA has requested
Yes, ma'am.
that there be an action plan in place.
Yes,
and
ma'am.
y'all are-
Yes, ma'am. They came down and did a physical inspection, and they found a couple of items, and we felt that because they were shortage of personnel, we didn't want the falls to continue, and we addressed it immediately, and they're taking corrective action right now, and should have that finished by the 7th of February.
And so those placements, were they by the VA medical, the people that you're referring
No,
to
ma'am.
that
No,
had,
ma'am.
they were
They're folks they're Pruitt employees. Pruitt has the contract.
the patients, I guess is what I'm asking. They were not there for any special,
No, ma'am.
were-
They're residents there at the
they
home.
were residents.
Yes, ma'am.
Is there a way for us to get a copy of that report or information?
We can certainly check on that. Yes, ma'am.
If it's possible, just
Okay.
send it to Michael, and then we
Okay,
can
Michael. Yes, ma'am.
take
We'll
a
check on
further
that. Yes, Madam Chairman.
look at that. That would be great. Okay. Chairman Benton.
Thank you, Madam Chair. I wanted to follow up the representative's questions about the cut at $777,000. This cut it's not going to mean any less care for the residents.
No, sir, that's correct. It will not. It will not affect the care of the. What'll happen, sir, is we may have to bring the census down a little bit. That's all. But the quality of care there in Augusta will remain the same.
Well, it looks like you brought the census down.
Yes, sir. And we may have to bring it down more, sir.
Well, if Pruitt is furnishing the RNs and so
No, sir, not in Augusta, sir.
Okay.
We have a MOU with Augusta University.
Okay. All right. One final question, Madam Chair. Over on slide 6, you made the statement that, and I was trying to write down and listen at the same time. Y'all were scheduled to open an office in Forsyth County and one in Clayton County, and you
Yes,
did
sir.
not open either one of those offices.
No, sir. No, sir.
And then that was 4 positions that were not used there, and you used
And we had 5 others.
5 more where you took a position away from another
Yes, sir.
field office.
Yes, sir.
Has that or will that cause there to be a waiting line in these other offices?
It could, sir. Certainly not in Clayton County or, North Fulton, because we've never had an office there. But we have, in the other offices that are mentioned, we have employees already there. What we're doing, sir, is when somebody retires or resigns, say it's a 3-person office, we're looking at all the statistics to see, do we really need 3 people in that office? And that's where we came up with those extra positions.
Okay, so that's just office staff. That's not the psychiatrist and.
Oh, no, sir. No, sir. That's our employee, our counselor, sir,
Okay.
inside the office.
All right, thank you.
Yes, sir.
Representative Henson.
Hey, ma'am.
Hi,
Hey, ma'am.
good to see you
You
again.
too, ma'am.
Question,
Yes, ma'am.
the Women's Veteran Office that we worked so hard on getting
Yes, ma'am.
established,
Yes, ma'am.
is that operational and,
Absolutely, ma'am. We've got her running all over Georgia. Miss Vita Brooks. She does
and she's still running that place by herself with
Yes,
no
ma'am.
help?
Yes, ma'am.
Can't we even put a man in there to help her?
Well, her boss, Assistant Commissioner Canavaggio, he helps out where he can, but What we've done, ma'am, is we've asked, we've asked for an additional person for a outreach coordinator in the offline request for that purpose to help out.
I was thinking that you'd probably need it once that became up and operational. That
Yes,
would
ma'am.
become too much for one person. And I
Correct.
hope that we're going to be able to do it. Secondly, I want to go back to this Milledgeville and the Pruitt managing. And you mentioned the inspection came down from the VA Medical Center. But was that done by our employees who work under the CMS and for the state?
No, ma'am, it was not.
It was
done-
strictly the VA.
The federal VA, yes, ma'am. Yes, ma'am, the medical center. Yes,
Okay,
ma'am.
that's
Out of
what I
Denver.
was wondering. And the tags, none of them were jeopardies, were they?
No, ma'am.
Okay,
No, ma'am.
fine. Thank you.
Yes, ma'am.
Okay, are there any other questions or comments for Commissioner Roby? I don't think I see any, so thank you, and thank you for the good work that you do. for
Thank
our
you,
veterans.
ma'am, and thank you for your support.
Okay. Okay.
Just warming up.
Hang on just a minute. Okay, so how do I do it? All right, thank you. Okay, next, the Department of Behavioral Health and Developmental Disabilities, Commissioner Fitzgerald, thank you.
Thank you. We set up there?
You pick which show we're going to watch.
Come on.
I think that'll disappear. There we go.
Thank you. Good afternoon, Madam Chair, members of the subcommittee. It's a privilege to be here today to present to you the Department of Behavioral Health and Developmental Disabilities amended fiscal year 20 budget. So if we could go to the first slide, I'll tell you what we're going to cover today. Provide a brief agency overview and budget update, and then tell you a little bit about how we approached the budget reductions, and then go into a little more detail program by program about what those budget reductions are, and then have a summary and conclusion for you. So, just a reminder, next slide. Agency overview. I know many of you are very familiar with the work of DBHDD, but just as a reminder who we are and what we do, DBHDD serves as the public safety net in Georgia in 3 disability areas for people with serious and persistent mental illness, substance use disorders, and intellectual and developmental disabilities. Our priority populations are most in need individuals who are uninsured, underinsured, or receiving Medicaid. In fiscal year 2019, DBHDD provided services to over 212,000 unique individuals throughout the state. And how do we do this? As you all are well aware, we have 5 state hospitals and a network of over 700 community-based providers throughout the state with whom we contract. Next slide. So, as I often do, I start with a snapshot of the DBHDD budget. And this simple slide gives you an overview of a lot of elements of our budget through the FY 2020 appropriation. It shows you state appropriations versus federal appropriations, and then it also divides between community and hospital, since those are both elements of our budget. And then another element that we like to point to on this slide is it also shows you what our administrative costs are, which, as you can see on this slide, are at about 3% of the total budget of DBHDD. We try to operate as a lean agency, and we're proud that we do. Next slide. Okay. This is a slide that has also become familiar to many of you who have been following DBHDD for many years. You can't see the numbers up on the screen too well, but what you know is this follows from 2010. The first yellow dot and red dot at the beginning of the graph are from 2010, where funding was in the state of Georgia. And then it takes you, the end dots are, of course, fiscal year 2020. And we use this slide to remind you about the important investments that we've made in our state. And you all have made those investments along with 2 administrations now. As you know, part of this was driven in 2010. DBHDD and the state of Georgia signed a settlement agreement with the Department of Justice and challenged us to ensure that we had community services available for people in our disability areas. Since that time, you all have made dramatic investments, as you can see them there. And the other thing I'd like to show in this slide, because it's been really important for you to see how much we've invested in building up our community services and supports for people with serious and persistent mental illness and intellectual and developmental disabilities. The other thing we've done alongside of that is we have maintained quality and safety within our hospital system. So the red line along the bottom that you see there, it's been important to us to say wherever we're serving individuals, vulnerable individuals with complex needs, we want to know that we're doing it with quality and safety in mind. So it's been a remarkable decade of enhancement of our system. What this has allowed us to do is move towards compliance with the settlement agreement, but I also want to take a moment to say it's been the right thing to do, to serve people in the location they need to be served, and to really be able to provide those services throughout the state. Okay, next slide. So, wanted to tell you a little bit of our overall approach to the budget reductions. First slide, we have some numbers here for you. As you saw on that first overview slide, it laid out what the state fund appropriation for fiscal year 20, you saw that, and I'll use round numbers here just to make it easier, coming in at about $1.2 billion. From there, we were granted 2 exemptions. And the first exemption was for the Medicaid state match, which totaled almost $285 million, as you see there. And then the second exemption to our state funds was for the tobacco settlement revenue. That was also exempt from our budget reductions. This was really important. As you can see there, what that did was reduce the state funds. After those exemptions, the state funds to which the budget reductions would be applied then went down to $935 million. So those were important exemptions we're grateful for. And what that took us to, just as we go into the numbers here, that left our budget reduction for fiscal year 20 at $34 million. Okay, so next slide. So what you see here, and it's important for us to let people know, how did we approach these reductions? You all know well, we serve vulnerable populations, but then we had the opportunity to embrace the call for efficiency and to set forth really across the 4 values that you see here that were really important to us. This was the charge from the governor, to find efficiencies and to make reductions, but to make sure that we minimize the impact to individuals that were currently being served. We maintained hospital safety and quality, very critical for us. Third, we wanted to minimize the impact on full-time staff of DBHDD. We've got a hardworking, mission-driven workforce, and we certainly wanted to minimize the impact there. And then finally, we really wanted to take a thoughtful approach so that our cuts were strategic, and that if we took a reduction, that we knew it would be something that would have a lasting saving along with that minimal impact on people served. So efficiency was a priority, and really embracing these values along with the charge of the governor allowed us to proceed in a way that we're going to tell you a little bit more about now. So what you see here next, I'm going to go in detail about each of the reductions, but there's a really critical point we want to make today. It's important for all of us, and I know all of you, as well as the folks at DBHDD, care deeply about the population of individuals that we serve. And so knowing that, as we've taken the reductions, we've had a very, very important goal in mind, and that was preservation of essential capacity that exists right now in the system. That yellow line you saw of all the buildup over the last decade. So as we approached the reductions, it became very important to say, how do we hold on to this really comprehensive system that we've built? So what we believe is that we have achieved in the reductions that I'll talk to you a little bit about, this ultimate goal of preserving the current capacity that exists, which allows us to say that individuals that are currently being served by DBHDD are not impacted. There is no impact on our current capacity to serve individuals. We also believe we've been very strategic in our hospital cuts, and it allows us to say that there has not been an impact and will not be an impact on quality and safety. And finally, embrace that opportunity to make sure that we did not impact full-time agency staff. And just as a little reminder, many of you are familiar with the core elements of our system. Next slide. Because I want to say a little bit about this drive to preserve essential capacity within our system. Again, think about that yellow graph line going up and what we did. Again, part of that was outlined in the settlement agreement with the Department of Justice, but other parts of it have been built in different ways. And just a reminder about a few of these critical areas where we remain preserving the essential capacity that exists. So I'll just describe a few of these. They're important. Core outpatient services. That's basically the heart of community-based clinics, what they deliver there, the ability to walk into a clinic, have an appointment, be diagnosed, and receive a basic package of outpatient services. That's what we mean when we say core. That stays in place. Very critically, the second bullet. BHCC, many of you are familiar, means Behavioral Health Crisis Center. The CSUs are our crisis stabilization units, and the private psych beds that we reference there are beds that we can purchase as an extension of DBHDD's crisis system. I want to say that because those are truly crisis beds. Our hospital beds are preserved for individuals with long-term chronic needs, where what I'm mentioning here is the private bed. When our crisis beds are full, we have an ability to purchase beds through contracts with private hospitals. Also listed on there, and I'm taking a moment really to talk about crisis, GCAL. Hope that's familiar to all of you. That's our Georgia Crisis and Access line, our 1-800 line that is available 365 days a year, 24/7, answered by licensed clinicians. And of course, Chair Dempsey knows the exciting thing we did last year was extend the ability, and now you can text and chat to that line as well. All of that is preserved. GCAL is how we deploy mobile crisis in every county of the state for people who are deemed in need of crisis response from mobile responders, whether they have mental health or intellectual and developmental disability crisis experiences in the community. In addition, we were able to preserve our current levels of housing and residential services, which are available throughout the state. Certainly want to mention APEX. That's our school-based mental health program. And in fact, we continue to expand school-based mental health. We have a new RFP out on the ground to expand so that more APEX services are available throughout the state. So we expect to award more contracts to continue to grow our school-based mental health services. In addition, our current levels of intellectual and developmental disability services have also been preserved statewide. And then finally, as I've mentioned, and you'll see in a little bit more detail here, we do believe with strategic cuts that we've made, we're able to preserve hospital quality and safety. Our hospitals, like all hospitals, have to meet accreditation standards and are monitored by federal agencies to assure that they do, and so our ability to maintain quality and safety there is of the utmost importance, and we believe we've accomplished that. Okay, so let's talk a little bit about the cuts. In order to do that, we have categorized. These are rough categories, but it makes it a little bit easier to group. Again, because we serve so many various program areas, I'm going to talk about the cuts in 4 categories. Category 1 are efficiencies, administrative efficiencies. Category 2 will be hospital operating efficiencies. Category 3 will be funding for services that had not yet been implemented. And then category 4 are areas where services were underutilized and either services or contracts were underutilized. And so we've identified areas for reductions there. So with those 4 categories in mind, let me go ahead and show you what the actual cuts look like. Great, okay, here we are, category 1, administrative efficiencies. So you see pretty directly there, our total administrative funding for the department was $38 million. A 4% reduction meant a cut in $1.5 million there. And you see we did probably similar to what a lot of other agencies did. We looked at training that was not mandatory or required. We looked at contracts, and we looked at contract or vendors that could be administratively reduced. So that yielded the $1.5 million you see there. Next. Hospital operating efficiencies. So we've simplified and just showed you here, as mentioned, we have 5 state hospitals. Those are DBHDD employees, generally speaking, in those hospitals. And our reductions there, we took a little different approach with our hospitals as we look closely with how could we achieve that goal of maintaining safety and quality and still take the reductions. We reduced it. We only took a 3% reduction in the hospitals. And you see the majority of that was in personnel reductions, and we had some operational reductions across our hospital system as well. That yielded $7.1 million there. I also want to make clear it was very important to us, and we were able, you see some notation at the bottom of the slide about employees. We do have the ability to make sure that anyone who did find themselves on the end of this efficiency could be matched with a job that existed within the hospital system. So we have no reductions in full-time agency staff while we took these reductions across the hospital system. Okay, category 3. These are program areas that were new or funding that was not yet implemented. It might be for a couple of different reasons, so I'll try and talk just a little bit about that. So hopefully some of our initials here will become clear. Where it says AD, that's addictive disease, MH is mental health, and A is adult. So that first line item you see is adult addictive disease residential treatment services, and you see the reduction there was about $4.9 million. And then line out the rest of the items on this slide, again, in areas that were not yet implemented, were child and adolescent mental health categories. CSU enhancement, high fidelity wraparound, supported education and employment, and crisis respite support. And just to answer a question, which I think would be on your mind, why was it not yet implemented? So I think the addictive disease residential treatment services, this is money that came forward in 20. When we develop a new program model, we were developing a model that we did not have in existence anymore. So when the dollars come, we have program experts and staff that will the reduction target. Okay, final slide. and then you may have questions, I'm guessing. But I do want to say this, important for us to say. We are eager to continue to serve Georgia's most in need citizens, and we seek to do the following. We will continue to look for efficiencies. That's our responsibility, and to embrace innovation. Certainly in healthcare, there's technology and a lot of other things that we can apply to continue to improve the array of services that's available. How do we do that? In many cases, we work cooperatively with other agencies, providers, sister agencies, and all of us together are trying to address workforce challenges that we all face. Ultimately, what we commit to you is that we will have accountability for the dollars that we serve and be able to tell you more about the outcomes that we achieve. And then finally, it's our responsibility as a safety net to really thoughtfully plan and really embrace the call for us to serve the most in need population. So as we look forward, there's an opportunity here that we see as we face challenging months ahead, and that is really to utilize what's been put in place, certainly by the governor, state leaders, is the Behavioral Health Innovation and Reform Commission. Legislation that stood up that commission last year said, we have a complex system in our state. We really should take a thoughtful look at how we make expenditures. And so over a 4-year commission lifespan, there is a really esteemed body of individuals that will serve to look deeply into some of the critical areas that we recognize are challenges for all states as we head into the future. Of course, one of your members on the committee here, Representative Hogan, serves on the Behavioral Health Commission, so he'll know and understands the priorities that have been set forth through that commission and the challenges, and really using that as a vehicle for how we make sure that we're collaborating and we make strategic decisions about how to address vulnerable populations in Georgia. I'll conclude there.
Thank you. We do have a few questions lining up. Let's start with Chairman Benton.
Thank you, Madam Chair. First of all, Commissioner Fitzpatrick, I appreciate all y'all do with your agency. Y'all are certainly one of the heart and souls of the whole state government. I've got a couple of questions that I'd like to ask. One, these deal with outsourced contracts.
Okay.
Could you tell me the major outsourced contracts that DBHD currently has and what services they provide?
Not in a way. We'd be happy to get that information
Okay.
to you. I don't want to do that off at the top of my
Okay.
head.
Were
yeah.
these contracts reduced in the mandated cuts?
I want to make sure I'm answering the question you're asking.
Well, the outsourced contracts, were any of these?
Loved one that might have a need. We ask them to put their name on the planning list so that we as a state can be thoughtful about how we allocate dollars in the future, who has immediate and urgent needs, and then who has needs. Many families come onto the list just so we know, but they might not need services for decades, but they want to be on the list. It allows us once a year to be in touch with them and connect with them and make sure that we are keeping a good understanding of what the needs are throughout the state.
Usually your budget goes up because we add people on a constant basis. Are we going to be able to add people this year? Not just on the waivers, not just the housing.
You mean what we are able to do is preserve the essential capacity that we have.
Which is what's urgent and pressing and must be taken care of right away, that you're going to be able to take care of it.
Yes.
Okay, thank you.
Thank you.
Okay, Chairman Hogan.
As time passes, you know, the demand for services is going to increase tremendously. The staffing in the community health, mental health services is this affecting the staffing patterns and salaries and so forth of the people working for community health centers?
So again, what our hope is and our plan is, based on the way we allocated the reductions, was to not make an impact on the current and essential service delivery system as it exists right now.
So as positions become vacant, then they will be filled under the current situation.
Absolutely.
And of course, you know, crisis beds are probably our biggest need in the communities. You know, it's just really sad to see some of the crisis situations that we face. People not on their medication and trying to keep them on their medication. And our jails are full of our people. And just in Glenn County, the sheriff has a full-time psychiatrist trying to deal with the jail population. The psychotropic meds are just out of sight. So we've got to try to do something about our jail population. State facilities as well as local county facilities are just loaded with our people. And we need to try to look at some sort of legislation or something to deal with it, and I hope we're able to address that through the commission. But it's a crisis situation in the communities. And I do appreciate the crisis beds we were able to get with you in Brunswick, and I thank you very much.
Well, thank you, and thanks, and I'm glad you're the voice of a member of the commission, because this has stood out loud and clear as one of the charges is really to look more closely and strategically about the intersect of mental illness and the criminal justice population. So that's one of the primary subcategories, as is workforce. And I also want to mention, appreciate that you mentioned it, there are 3 more crisis units that are being built right now. You well know, one in Savannah, one in Macon, and the third one in Gainesville. So even though at a time where I'm telling you the important thing is to preserve essential capacity, there is some increased capacity that's coming online with funds you already invested.
You know, I think we're fortunate to have both Chairman Hogan and Representative Oliver on that commission, and certainly the questions and the comments you're making are so important to the discussion today. I would ask, are there any more questions or comments? I don't want you to feel limited. I know the wisdom and I guess too the hearts that you both hold for this subject. So if there's anything else. No, okay. So Commissioner Fitzgerald, I want to thank you so much. I know this is hard, and I think it's very important for us to remember that this is meeting a request. None of us in this room would desire that any cuts be made. If we could make it whole and better and keep moving forward like we were, that would be the greatest, I think, hope for this Appropriations Subcommittee. We have put a lot of money into this area over the years for great reason. It is important. Capacity is important, but demand is important. And when we talk about not being able to possibly meet some of the growing needs of Georgia as our Georgia grows, that is challenging. It's hard to wrap our minds around it. It's hard to just sit back and say, okay, we'll do that. And I appreciate the exercise and the education process you've gone through to help all of us try to understand the realities of where we are and what we need to do at this moment in time. I'm worried about some of the new things, though, that we don't know about now. You know, we've had discussions about our farmers, and that we don't know the full impact yet as they begin to rebuild and meet with that frustration and the rising numbers of suicide and mental health breakdowns just within the agricultural community and the rural areas of our whole state. I want you to know how important that is and the services to get there. When you talk about private hospital too, it's hospitals all over the state. Everyone needs to realize that they are embedded in each and every community where there is the ability to care for that person. So that comes to the workforce issue as well, like finding and encouraging and building up that workforce. This is a great big challenge, and I want you to feel that we care deeply about it. I know we could sit here and ask a lot of questions. You've done 2 great presentations. You've given us a lot of information, and I know that your team brought forward proposals to meet the request that was made of you, and that the team from Office and Planning and Budget have come forward with where, after reviewing it, they feel the best places are for us. And now I'm grateful that the House is going to take the look that we are always charged with doing and see what we can possibly do, and try to do the best with great care and concern. So there may be more questions there from the committee as we work through that process. There may be more contact with you and your team just to see if there are some unanswered, issues where maybe we think we can help. But please know that if we thought we could do anything to make it whole, we would give it that. So thank you very much.
Madam Chair and members, thank you very much. I think we all share great passion around this issue. Thank you.
Thank you. Okay. Next up, we have the Georgia Council on Developmental Disabilities.
Turn this off.
And I do apologize. I don't know if we are being heard or seen beyond. Okay, we are. We had gotten some messages that it was a little bit spotty, but I hope we are, because I know we do have people who follow this closely and reference it. We will reference it as we go through the process.
Good afternoon, Madam Chairman, members of the committee. I'm Eric Jacobson. I'm the Executive Director of the Georgia Council on Developmental Disabilities, and I guarantee that my conversation is a lot easier than the one you just had. So what I really want to present on today is the state funds that we get from allocated from you are around the inclusive post-secondary education programs that we've been developing over the last 5 or 6 years at this time. So just to give you some context, we get about $2.2 million in federal funds through the Developmental Disabilities Bill of Rights and Assistance Act, and then the state of Georgia allocates about $579,000 currently to the council as well. $500,000 of that is for the inclusive post-secondary education program. $14,000 was for a rural camp in North Georgia that was put into our budget by one of your members, and we made sure we thought we were going to make sure they got those funds. You'll see that that's actually one of the places that we're cutting currently. So essentially on the budget tracking sheet that you all have, and this is page 3, it's section 15.12, which is the council's. Again, you see $579,000 is what we receive from the legislature, and that we're required to cut about $23,000, a little bit more than that, during the amended fiscal year, and then an additional $34,000 once we get to the FY20 budget. We're proposing that those cuts be taken in a couple of ways. One is the $14,000 that we got for the camp will be eliminated, and then we managed to find some money. You all might remember that a few years ago we used to put on something called Disability Day at the Capitol, and as a part of that event, we did fundraising. We got corporate sponsors and other ways for helping us to fund that project. When we stopped doing that, we thought all those dollars were spent. With the help of the Department of Behavioral Health and Developmental Disabilities and OPB, we actually found that a little over $30,000 was still available to us, and we didn't even know it existed. So most of the cuts that we're going to be taking as part of the governor's reductions will come from that $30,000 that we found in unrestricted donated monies. The remaining amounts of money we'll take from we'll do a couple of things. One is we have a separate contract with the Center for Leadership and Disability at Georgia State University, which provides technical assistance to the inclusive post-secondary education programs. That's funded with our federal dollars. If we have to, we'll take money from that contract and redirect it to the schools, and I'm going to tell you what the schools are getting in just a second. And then if that still doesn't make it, we actually expect to get a little bit of an increase in our federal allocation this year with what Congress passed. We don't know the exact amount yet, but when that number comes in, we'll probably have to use some of that to cover the costs as well. But what I really wanted to do is to give you a little update on where we are with the inclusive post-secondary education programs, because we think they're running really great and making a difference in a lot of people's lives. And I think that's why you funded these programs, and that's really what we want to talk about. So in the packet of materials, I'll go through quickly and then answer any questions, just so you have an idea of where we are. A reminder that this is not just a Georgia initiative. This is a countrywide initiative of parents who in the past never had a thought or an idea about sending their kid with a developmental disability to college. And now with efforts like that through the council and you and across the country, there are over almost 300 programs across the country for kids with intellectual and developmental disabilities to attend college. And these are specific inclusive post-secondary education programs. And Georgia's, by the way, is really within the top 10 in terms of how large it is very quickly. I mean, you remember that it was only 10 years ago we had one program with 2 kids. So we've really expanded it very quickly. You'll see on the third slide that kind of where those programs are located across the state. We have programs at Kennesaw State, Georgia State University, East Georgia State, Columbus State, Georgia Tech, University of Georgia, Albany Tech, Georgia Southern, and the University of West Georgia. And there's conversations about adding a couple more if we have the finance to do that. The next slide that you have just gives you a different picture of what that looks like and really how the program has grown and expanded. Again, from those 2 kids back in 2009, the actual current numbers are 136, and I'll explain why we're down 4 in just a second. So we've really this has really blossomed from one little program at Kennesaw State that the council put $25,000 into. We're now looking at about a $4 million budget across the board between the legislative dollars, federal dollars, money from the council, and money from families as well. Yeah.
Are we supposed to have, you keep referring to other
Oh, there's a packet. I'm sorry. I'm sorry. Yep, that's it. The next slide that you see is actually a breakdown then of each of those schools, the number of certificate programs, meaning how many programs do they have. Kennesaw State and Georgia Tech actually have 2 programs. So most of the schools are 2-year programs. At Tech and at Kennesaw State, they're 4-year programs. So you actually go 2 years, and then you can go an additional 2 years as well. And you can see the number of students break down from 44 at Kennesaw State to 3 at Columbus State, and again, growing every year. Those award amounts, you'll see the $425,000. The remaining amount of that to the $500,000 was when you all appropriated those dollars. I requested that I be able to use those funds to hire a staff person so that we could actually monitor and oversee the implementation of that. So $425,000 is what we've given to the schools, from $77,000 to Georgia Tech to $13,000 to Albany Tech College. Probably one of the most important questions that we have about the inclusive post-secondary education program, and I know it's been raised not only in the context of conversations with the council, but also in conversations with Georgia Vocational Rehabilitation Agency and others as well, is what's the outcome? What's the outcome that we're looking for when you send a kid to college? I can tell you, I had one kid that went through college, one that didn't. The one that went through college, the idea was still the same as the other kid, and that was you get a job when you get out. And that's what my mom told me when I went to college as well, and I'm sure you were told the same thing. So we really wanted to look at this idea of, does attending an inclusive post-secondary education program result in increased employment for people with, for students coming out with disabilities? And actually across the board and across the country, we're finding that that's absolutely true. And in fact, 75% of the 2017 graduates, we don't have a lot of graduates to work from because we've only been in this business for a few years, but 75% actually had employment once they graduated from the inclusive post-secondary education. And you can kind of see how those numbers have increased as we've had graduates. And we think that is the outcome that you're looking for. It's the outcome that we're looking for. It's the outcome that people, families and their students are looking for as well. We really think that there's great potential that once a child has gone through the inclusive post-secondary education program, that they will find a job based on their passions and desires when they graduate. So the final thing I really wanted to do was just tell you some of those stories because I think it's important. And I'm just going to focus on 3 stories right now, although we have many more. So the first story is George Barnum. George Barnum is at Georgia Tech, and I included this because I thought his statement was something that we all should be thinking about on a regular basis. My life would not be the same without Excel. Excel is the name of the program at Georgia Tech. Back in my high school life, I only had drama class and the running team to fit into. Now in Excel, I belong everywhere. I think it's a really important statement that this is, and by the way, this is not the first story I've heard of a kid that went through the inclusive post-secondary education program, and the comments they made were about growing up and being a part of a community called the university and no longer relying on mom and dad and having to learn the skills necessary to be independent. So I included this one from George because I thought that quote about "now I belong everywhere" is really important because that's the secondary outcome that we're looking for in these programs, and that is that people become more a part of the community that they live in. Justin Mahas at University of Georgia currently works with the Athens-Clarke County Leisure Service Department as their inclusion aide, and he supports kids with disabilities. And then finally, Deontay Brown. I want to tell you Deontay's story. I didn't include it here because I wanted to tell you personally, I think this is probably one of the most exciting stories. And that is Deontay is at was at Georgia State University as a part, and the Georgia State program is focused on the film and TV industry aspects. I'm not very good at whatever that means, but whatever that means in terms of working in films and TV, that's what the IDEAL program has been focusing on. And so Deontay had that desire, and so he got an internship with a public relations firm as a part of his work at IDEAL, and actually that public relations firm we've done some work with, and they really enjoyed him and brought him on. But the most important thing is Deontay just got hired by CNN. So to me, that's the huge jump, right? That's the huge jump where we're able to actually say people with disabilities went through inclusive post-secondary education programs. They're not working at Kroger as baggers. They're working at CNN. And I think that's an amazing story. And Deontay just started there, I think last week or the week before. But when they called and told us that story, I was very amazed. And again, to me, that brought the smile that this is exactly what we were trying to accomplish. And I do have a 4th story. I think you all know the 4th story, and that is there's a gentleman back here sitting behind me who went to the Kennesaw State program and then graduated from that, spent an internship with GCDD, spent an internship with the governor's office, went to Georgia Vocational Rehabilitation Agency, and is now the public policy legislative advocacy director for the Georgia Council on Developmental Disabilities. I think you all know Charlie Miller, and he's another one of those great stories of folks that have come out of our inclusive post-secondary programs and really taken and gotten a great job. So that's my story for today. We know it's going to be, we hope not to have any kids affected by our cuts, and we think we can make it up with some other funding resources. So I'll answer any questions that you have at this time.
Thank you. Are there any questions or comments from the group?
Thank you all.
Don't go away, though, because I want to give you a little praise.
Oh, thank you.
You're doing such a great job. I do want to ask, so just to clarify, so the summer camp, it will come back, or that money? No,
that money's gone.
Have it this time.
Yep.
It's gone.
It's gone.
For now.
For now. right? Unless we get those dollars back, correct?
Well, you know how much I care about IPSI and appreciate
you
the
do.
work you've done, and I was there when Charlie Miller graduated.
GAFCP performs the critical function of outlining that path for communities, supporting them with the very best information that we can to apply their local knowledge, bring partners to the table, make tough community-level decisions about who, what, when, and how using data, and to do the actual work that makes the difference for our state's children and families. We call this our discipline model of collaboration, and I will share with you it is to the envy of many other states around the nation. GAFCP works with state partners to curate the latest and most reliable data, research, best practices, and information from state-level conversations and decisions, and communicates that information to communities in a way that's useful. Local collaboratives take that information, integrate it with knowledge of local issues and people, share it with partners, and together with those partners, they come up with a plan that is going to produce results. I won't take much more of your time because I'd like for you to hear from my colleagues who lead this work in their communities. But before I turn it over, I'd like to emphasize a couple of points. Family Connection was created to address inefficiencies that occur when the right hand doesn't know what the left hand is doing, and to close gaps in services that are more likely to occur during tough budget years. Before the cuts, the state's investment had just returned to pre-recession levels for the local collaboratives, and we were starting to inch back toward pre-recession amounts for the state-level part of this work, which has taken the lion's share of the cuts over the years. Work like the Get Georgia Reading campaign, the Quality Rated program, the DFAC State of Hope, our partnership initiatives with DJJ, ACCG, and GMA, and others too many to name right here. While grateful for the state's continued investment, it will be difficult to continue to grow the work and to produce the outcomes we want if funds continue to fluctuate and diminish. We respectfully request you restore each local collaborative funding to $50,000 and restore the $111,892 to JFCP's 2020 budget cut by the recent reductions that occurred in October 2019. Again, thank you for your support and investment of this very valuable work over the past few years and going forward. So at this point, I'd like to introduce you to my colleagues, Edwina Turner, who is coordinator of the Stewart County Family Connection, and Janet Adams, who is the director of the Atlanta Fulton Family Connection.
Again, thank you for letting us speak today. As again, my name is Edwina Turner, and I'm the coordinator for Stewart County. That's in the southwest quadrant of Georgia. It's Region 8, and there are 16 counties in our region, going from Harris all the way down to Clay County, from the river to the river, so to speak, because we go from Quitman County all the way over to Crisp County, which is on the river over there. So although my work is primarily in Region 8, I'm here today representing all 159 counties and their coordinators in the network. I'm proud to be a part of this network. Like Gay said, it's the only one like this in the country, and there are 49 other states looking at us going, we need to do that. So we exist to craft local solutions based on local decisions to some of the most challenging issues faced to our children, families, and into our communities. As you heard Gay describe, our network is supported and enhanced at the state level by Georgia Family Connection Partnership. We focus on 5 measurable areas. Each county adopts priorities based on their indicators for their child well-being, but all of those we work under the 5 areas, which are healthy children, children ready for school, children succeeding in school. We have that their families are stable, self-sufficient, and productive, and that our communities are vibrant and thriving. All over the state, we're working toward these goals. One example in Stewart County, in fiscal year 19, we had decided our annual plan was to partner with our Head Start program. Our reading level is not where it needs to be, so we decided we were going to read to our children every month, and when we read that book, we were going to give them that book to go home, so we were going to create a home library. Well, Stewart County School System applied for and received an Help for Georgia grant, so that helped us because we helped them write that grant. We were able to make sure we did have enough books to send home with those children. To understand this, there's a survey that goes out with Head Start, and one of those questions is, how many books are in your home? Those were coming back saying 0. And then there's a little program down at the bottom that says, how many minutes a night do you read to your children? Those were being skipped over. This is our second year school term doing this. And today, when I talked to our Head Start coordinator on Monday, she told me that those surveys are coming back with anywhere from 5 to 10 books in their home, and they are reading anywhere from 15 to 30 minutes at night. We're making a difference with our families in Stewart County, but without our money, we're not going to be able to do that. Another example, as most of you see, I have on a very bright shirt. In our community, we are that bright shirt, that bright light in our community. We're that go-to person in the community for resources, for family tutoring, for family help, for summer food programs. But I'm going to give you an example. This is what's happening in our communities with our bright shirts and our bright lights. They're being covered up because our money is dwindling away and it's disappearing. So now we're no longer bright. So with your help, we'd asking for each of you have data that was given to you in a notebook, a folder, about what's going on in your particular county with your particular collaborative. On behalf of my colleagues in all 159 counties, we're asking you to please consider reinstating our funding back to the $50,000 that it was at the pre-recession amount. We're going to, the General Assembly, to restore this funding for fiscal year 19. And we're asking you to go back and redo that again. We had that for 1 year. The second year, we were all excited, and then in October, it got taken away from us. So due to the reductions, we're currently receiving 48, and we're told we're probably going to receive 47 this coming fiscal year. So again, in my county, it's very rural. When I tell you that some of our parents drive 10 miles to the grocery store, I know in Fulton County that's unbelievable, but that's what our parents are having to do. So resources are very, very few and far between, but we've managed to take the monies that you have appropriated us for every dollar you give us. We leverage $4.10 back to our communities. I'm very grateful, and I know my colleagues are very grateful that you will reconsider reinstating our money. So we would like to return to being the bright light in our communities. So thank you for your time, thank you for your consideration. Now I'm going to give it to Janet Adams, Fulton County.
Thank you, Edwina. Thank you, Board, for hearing us today. I'm Janet Adams, the Director of Atlanta Fulton Family Connection. Like Edwina and Gay, I'm here representing both myself in the local capacity, but as well as my Family Connection colleagues across the state. I'd like to spend my time highlighting one of the examples of Family Connection collaborative model in action. I hope it will help you understand how our small investment that we receive yields big returns, and how we are full partners with you, the General Assembly, in achieving those things that we purpose to help our communities as public servants. At the state level, Georgia Family Connection Partnership is hosting Get Georgia Reading campaign. They look on this role because of the existing infrastructure that existed in Family Connection. This campaign is working to make sure our state's third graders hit the milestone of reading on grade level, because that determines their trajectory as well as their futures. Plainly put, if a student doesn't read on grade level by third grade, their entire future can be affected by it. When we began this work, 2/3 of Georgia's third graders were not meeting that milestone. Georgia Family Connection Partnership brings state and community partners together and makes sure all key voices are heard as we work toward this common goal. They ensure state and community leaders have access to the best data, the best framework for organizing, content and expertise, technical assistance, that they can develop meaningful and implement real-life strategies to overcome roadblocks and evaluate our progress. That's what Georgia Family Connection Partnership does. On the local level, as a collaborator and a person who is a convener of partners, what I try to do is bring the data so that we can use that and create meaningful programs that really address the information and really address the issues, providing information that we can use to improve the community that we are serving. And hopefully by doing that, partners are able to join together and rally behind each other as we do this work. In the neighborhoods that we chose for the Get Georgia Reading campaign, those zip codes were 30315, 30344, 30337, 30312, just to name a few. And what we were met with is in the poor performing schools in this area, those children were anywhere from were reading from 9% to 20% on grade level, which means close to 90% of these children were not reading on grade level. In those 12 poor performing schools that we did our work in, those individuals had principals that came to the table as well as teachers who asked for our partners to partner with them to help meet the needs of these families, because it wasn't just about reading. It was about the types of trauma that these children as well as the families were facing. So as we did that work, we found that we tapped into partner relationships that we could build upon. And without family connection, it wouldn't be anyone's job to do this type of work. It is very hard. It is very difficult. It is very, can be traumatizing at times when you hear the stories of what families are facing. Children that are coming to school that have not eaten, and the only meal that they will get may be the meal that they get at school. So therefore, the teachers are met with a child who may be crying and can't do his work because their tummies are empty. Collaboration is hard work and can be messy. But when you have Georgia Family Connection Partnership behind you, and we are bright lights, and we do offer encouragement to the teachers and families. A lot of the work that we're doing is provided through wraparound services, where we literally are feeding families and clothing them. But we're also providing books for them. And we go out of our way to apply for grants so that we can provide the needs of these families. And the teachers, the principals, as well as the families are overjoyed by the work that we're doing. The grade level reading effort is a national one, and I'm proud to say that Georgia has really caught on to it, and that we have 100 campaign communities, by far the most in the nation. Just like my community, each of the others are implementing local strategies to improve indicators which will benefit our state's economy and workforce. This example alone shows how vital this network is, how Georgia's future depends on how well we collaborate and work together. And when I think back as a child, one of the things that I was taught by my parents is how well we get along and how well we work together that promises a great and good future. If we can move the needle on grade level reading, it will improve not only early child care system and strengthen our civic engagement, but it will make Georgia a great place to live. It will make us a place where we can employ our individuals that need to be employed. But it will also produce productive citizens. We'll also be the best place to go to school, the best place to find a job, and also places where we want to raise our families, places where we enjoy a high quality of living, where we'll have productive life, where all can contribute and give back to our respective communities. That's what Family Connection is about. That's what this network is working for every day. And it's also why I chose to do this. Although I've been a public health official for over 29 years, when I chose to continue to give back after I retired, I chose Family Connection because I knew they believed in what I believed, that each one should reach one and help another. That's why I believe that this committee and the members of the General Assembly will work with us and agree with us that we should be restored and receive our original $50,000 that we would receive per county, and restore Georgia Family Connection Partnerships Fund so Family Connection can be full partners with you. Thank you for your time today. My colleagues and I am happy to answer any questions that you might have.
Thank you. Thank you. Are there any comments or questions? Right. Chairman Hogan.
Thank you, Madam Chairman. Each county gets 50,000. We're getting 50,000. Fulton County was getting 50,000, and then down in South Georgia, each county down there was getting 50,000.
That's correct.
There was no difference in the population, or how did that formula come about? I mean, for $50,000 for each county, regardless of the population.
Yes, that was part of the intent with the creation of the Family Connection grant, was that every county would receive the same amount, and then it would be up to that county to figure out how to leverage that money to actually implement their plan. But the legislators at the time felt strongly that it should be available to every single county in the same amount. And so that's the reason, and it's always stayed that way since the very beginning.
Do you understand the legislative reasoning in that?
They all wanted to have their counties treated fairly and get the same access.
Okay. And how do you take $1 of state money and turn it into 4.1?
Go ahead. You go ahead.
Every county collaborative approaches that a little bit differently, but what they do is they write grants on behalf and with partners to private funding sources, to other state agencies, federal grants. They have local partners such as chambers of commerce, county commissioners, school boards, am I missing some, faith-based, that are also willing to contribute. So what they do is they take your first investment into building that collaborative infrastructure and turn around and capitalize on that infrastructure and those partnerships to try to look for additional funds to support their annual plan. And again, it comes from, and I can get to you the percentages that come from different stakeholders, but the aggregate of that comes to about $4.
Thank you. Madam Chair, what is your relationship between organizations in each county, like Department of Public Health? I mean, what kind of services do you provide? Root services. Do you do meals? We have Meals on Wheels. We have different meals in the school systems. What do you all do? Sounds like it might be somewhat of a duplication of services, so I need to know a little bit more.
Examples that we have in Fulton County, and the basis of the plan is convening the partners and bringing them together so they can bring their resources to the table. When it comes to feeding, one of the partners that I closely work with does a backpack program. She brings backpacks full of food to each school that she serves, so those children who normally would not have food at home can get that food, take it home, and have that to eat off, whether or not they're doing it for vacation periods or just on a weekly basis for those families that are having issues. Maybe the parent is laid off, or it's a single parent who can't afford to get all the food that the family would need.
The beauty of the Family Connection Collaborative model is that you've got all of the stakeholders around the table trying to avoid duplication and inefficiencies, because back in the day, people operated in their own silos and did not communicate across the public and private sectors. So some of the same families and same services were being given to, and that was not a very strategic way to do business. So the collaborative table allows for the conversation based on data, based on the resources in the community, the folks who are doing the direct service, to come to the table together to determine who's doing what for which population. Are there resources that could be shared? Should resources be redeployed somewhere else because someone is already doing that? So we do not provide direct services. We make sure that those who do are in the room together. We convene that, we bring the data, and we try to figure it out together. And that was not happening before the creation of Family Connection.
Madam Chair, how did you come up with the statistics for my House District 179 on children attending preschool 3 to 4? You know, you said the state average is 50.1, and in Glenn County is 42.5, and the rest of the statistics you came up with. How did you come up with that information?
We have data agreements with all of the public agencies, so we gather our data from Vital Statistics, Public Health, DECAL, Department of Education, Governor's Office of Student Achievement, as well as the census data we provide. We get directly from the U.S. Census Bureau so that we're able to drill down to the exact populations that we need to be targeting, even by census tract. So that data came from our data partners. Then we compile it in a centralized, easy, accessible place for our counties and our partners. A lot of our state partners go to our database because everything's there, rather than you're having to go to all the different partners to get their data. So that data is scrubbed, I think it's the data term, but it is looked at, scrubbed, and released. And as soon as the state agency has the updated data, we immediately refresh our data system so it's the most up-to-date data by city, county, school system, legislative district, and now in region, and now by census tract.
Madam Chair, in say my county, Glenn County, how do you work with those people down there? I mean, like the Coastal Area Action Authority. I mean, they do a lot of what you're talking about, and they are out there delivering their services. I mean, do you work with those organizations?
Absolutely.
And what do you do with those organizations?
Well, most of us have a monthly collaborative meeting, and all of those different entities come to that table. And they're, just for instance, in Stewart County, which is not your coastal county, it's far, far, far away from the coast, but our public health nurse was trying to do something with a health fair. And she was sitting at the table, and the county commission says, well, that's in our comprehensive plan. We are supposed to be having a health fair. And so they looked around, the Department of Public Health, our health nurse, myself, and the county commission all got together, and we had a health fair, and we had over 55 agencies that offer services in Stewart County. They're not necessarily had a brick and mortar, but they offer services in Stewart County. And it was just because she was over to the side trying to do that by herself and having little 2 or 3 people. And then the county commission were actually trying to figure it out, and they didn't know how, but at the collaborative table, that got asked at the table. And so we were able to collaborate our services together and have that huge health fair. We had over 300 people visit our health fair that day. Anything from services as Air Evac came and brought their helicopter. We had people sign up for yearly prescriptions or subscriptions to the Air Evac services. They were testing for HIV testing. We had car seat training there for people to pick up car seats through. We had WIC was there, all sorts of different entities. And it was because they were at the collaborative table, and the 2 entities were trying to do this on their own at different places and different times. And we just came together and had one big one.
Thank you.
And I'll be happy to talk with you offline specifically about some of the things that your coordinator, Melinda, is doing in Glenn County and her partners.
Yeah. Chairman Hogan, if you would look on the bottom of your second page, probably, it will give you the name. And I'm curious to know what it is. I mean, I know mine. I've served on that board for many, many years. The bottom of this document that has your specific information, look on the second page and see if it lists who actually with her. Okay. Let's see. Next, we have a question from Representative Henson.
Thank you, Gay. I probably remember from when you first started all of this, and you were in Savannah, weren't you?
Yes, I did this work in Savannah, Chatham.
I remember that, and going over, forgot where you were. You've certainly expanded this to be able to include all 159 counties in Georgia. How long ago did we finally raise it to $50,000 per county?
2019.
So it's just a recent increase. Was it a $3,000 per county increase?
Yes. It went from 47 to 50. That's basically where we were pre-recession, which would have been the 2008, I think, is when we started backing down, but as did everyone else, of course. But
I know. And the full 3,000, is that meet the required budget cut?
Yes, ma'am. Right now, with the current 20 amended, we had the total cut of $374,000. So the state took part of that cut, and then the county collaboratives took $2,000 each. And then when we looked at the 2021 projected cuts, they go a little bit deeper when we looked at how we could best keep the counties at as close to 50 as possible. The partnership is taking its cut, which is, of course, a double cut because we match it with federal, and it will take the collaboratives to back to 47. Yeah.
What is the federal match?
Right now, we've got our total budget in 2020 was roughly $10.7 million, and the funds cut $374,000, and in Medicaid alone, our match from Medicaid was $1.3 million, roughly $1,328,084. So with the reduction in state funds, that is lost. Another 55.9 will be lost. So every time we lose a state dollar, we lose a federal dollar.
Is it an even 1-to-1?
Yes.
Okay. Thank you. Thanks for all that you've done over the years. I know how important it is to get out of the silos and to bring folks together and working together. So thanks.
Or did you have your button pushed?
Were y'all going to review this? I see my house district number on it.
Pardon? Were
Was
we?
this information?
Yes. Yes, we generated that for each of you, just for you to have as your background.
Okay, I see. She's got hers.
Yeah.
But yeah, I'll speak into the mic, but I am pretty much familiar with the Family Connection in Augusta. I work closely with Candace Hill, who she's just joined that, or well, not just joined, but she just was appointed into that position. Right. Who followed Miss Dr. McKenzie,
right,
who worked with the organization for many, many years.
Long time.
And did an excellent job. But I was trying to understand the book program that y'all done in Stewart County and the feeding program and some of the other things that you're doing in Fulton County. How do you implement this book program to make it working through the schools? Well, you through Head Start, you're not going through the school.
We have a great partnership with Head Start. Head Start comes to our table every month, so does the school system, so does the county commission. But as I said, on our survey, it showed that there was 0 books in the home and there was no reading time being done. And that was something that the collaborative talked about, and they thought that that was where we needed to start. Well, in the meantime, as we were discussing our annual plan that would take effect come July of that year, which was in 19, the Stewart County School System, along with myself, wrote for the Alpha Georgia grant, which is a literacy grant that was put out through, I think it's federal funding. And the school system, and it has to be from a 0 to 5 aspect, elementary, middle, and high school, and Stewart County received all of those grants for their entire school system. And our school system, everything from Head Start through 12th grade is on the same, in the same area. Head Start is not manned under the school, but it sits out there. And so we decided that we were going to try and write for some a Dollar General grant to get funding to help buy those books. And we were thinking maybe 2 months, maybe 3 months, because that's 30 children. And we were being optimistic, but then when we got Alpha Georgia, we were able to buy the books because it was our 0 to 5, and that was one of the things that when we wrote the Alpha Georgia, we said that that's what we wanted to do. So it's implemented by, I have people that come to my collaborative that volunteer, and we go once a month to the Head Start. We sit down with the children, we read that book, we talk about that book, we have a game with that book, and then when I leave those books for the children. Everybody takes that same book home, and then I leave a classroom book. So we're not only building the classroom library, we're building those children libraries at home. So, and we also have our first readers. It used to be First Foundation. So those same children get the classroom packs of first readers get sent to the school, and the teacher does the same thing that I do with the first reader that they get, and then those books are going home. So they're taking 2 books home every month, so that whereas they were not having any books at the home.
So it's based on the collaborative between the partnership
right.
and
the
the school board.
Correct.
And Head Start.
That's exactly right.
Okay. They work pretty closely with you, the superintendents of the schools.
Superintendent is a Go Family Connection person. She's fixing to retire, so we're gonna have to reintroduce somebody. But yes, she works very closely with Family Connection.
Okay. This work is really being generated though from a platform that has been established through Get Georgia Reading, which Georgia Family Connection Partnership plays a major role in that. Before we started our work with the educators, there was a learning session that was actually put together by Georgia Family Connection Partnership and several of the state partners who were trying to address the issue of students not being on grade level as far as reading is concerned. So when those meetings were held, we were given the charge in our different communities to go back and bring partners together to look at what might be the issues faced by these families, which meant that we met with the principals, our board members, which represents the different school districts that we're working with, and then we established a strategy plan on how we would address the issues in the schools that had been identified. In some schools, we do in-school tutoring through our partners. In other schools, it might be just be providing books. So through those relationships that we have through those different partners, we are actively doing those programs that those children need, even to what I spoke about before, providing food if that's what those children might need.
Okay. Well, thank you for your work. Yeah, it's a great program.
As far as data goes, if there's ever any additional data runs that you'd like to see, different types of data based on your district, we'll do those for you.
Okay.
Just let us know.
All right, thank
We'll be
you.
happy to.
Thank you. Representative Henson.
As we sit here and talk about reading and how important it is, I just took a look at this back page. The anti-bullying program, if I'm not mistaken, is that the one put into effect by ADL into our school system?
Are you referring specifically to DeKalb?
Yeah,
Yes.
I think they worked on it. So you've worked with ADL, which is, I mean, it's incredible programs that they brought into our school. The Community Health Day, the Mobile Farmers Market. I even buy from it. I mean, they put out their cards. They're fantastic. I mean, the fruits and vegetables that they bring go to the same place. They're about 6 months that they're there. And it's just amazing. They have a repeat areas. They're bringing these in. So you are really, I mean, the outreach that you've got, this is just my area, not all of DeKalb County. It's great. And I've worked with a lot of these programs, so I just want to say thanks.
Thank you. That's what your investment in Family Connection gets you.
Right. Any other questions or comments? So before y'all move, I want to say thank you. I've been on the board of my local group for years and several directors in history, so I know that you do some mighty powerful work. The word collaboration, the first time I ever heard it was really when I served on that board. I feel like y'all invented it. That's how, I mean, it was about pulling people together that were so much in communities trying to do good things, but not working together to maximize it. This committee has had the privilege over the years that I've been on it of restoring those cuts. So many of us that have been here have made it a priority. It matters. It's important. We are in that posture that you've heard me speak about earlier today of dealing with the proposals here and seeing what we can do. But I want to thank you for the thoughtful presentation and information that you've given us and that we get every year from you and the visits that occur, because as legislators, so many people don't know. They haven't had that intersection to really know about it. I'm also aware that within the last year, you have had many things added to your plate. And those things were added because you were doing a good job. And they came from the governor and other organizations that said, we know we need to do more about getting our children up to third grade reading level. And they said, you're the ones who can do it. You have been acknowledged for the success that you have proven for our state. It's so important. Each community is unique. I'm well aware of that. The partnerships are unique. In Rome, we don't do what any of you are going to do. We're going to find what we need to do best, and it'll change. It's you know, it's always evolving and becoming better and better. I would like to know what the impacts truly on the ground, if you can, I know we've talked a lot about things, but as we look at the cuts, obviously they're dollars, not going to be going to a community. That means you have to be an even better innovator and creator than you already are, and you are proven to do that well. But when we really deal with these, what are some of the things that we might see not be able to continue in individual communities?
Well, for myself, my cut came from my general operating budget, which handles all of my supplies, and it also took all of my travel away, which has hindered me for going to some of these meetings in our region. But because I'm the person I am, I go anyhow and just take it. But there's a lot of coordinators who are not able to just go because they need to be reimbursed for their mileage to those meetings that they're going, and they're not able to go. There's some of us that are still going. I think the bulk of us go anyway, but that's it. And the leveraging of dollars is really hard to do when we're getting cut on the bottom side. And one of the things that we're doing hugely, that we started in May of last year, the bulk of your family connection coordinators are either chairing or co-chairing your complete count committees for your census in your areas. So I know I co-chair Stewart counties with our county commission, so it's huge.
Yeah, that's kind of the good news and the bad news. The good news is that people are really seeing the value and the power of the network to be able to have 159 county reach has really been, I think, taken advantage of by our state partners because they realize that some of their initiatives that we can really help push out quicker and also even direct them to places where there's higher need or there's some synergy and energy to get some high-quality work done quickly. So we've also begun to play, and we get lots of calls, and our plate's getting full. But that's the value, our unique vantage point. We see the big picture. We work with the state agencies, but we also have the ability to push and push it down and act locally, and continue to build the capacity to act locally. And we can't go backwards. We've made too many gains.
Well, I want to say thank you. And thank you for the work that y'all are doing every single day. Thank you, Director Smith, for a very thoughtful presentation.
Thank you.
Okay, so right now we have 3 people signed up to make comment for us. And the first one is Dawn Randolph. And the second one, and if I mistakenly say this name wrong, I want you to correct me. Larry Gluth will be next.
I'm going to let Larry go first.
Larry will go first, and then you. And then, then the next one will be Deanna Julian, and those are the 3. So.
Thank you, Dawn. Madam Chair, members of the subcommittee, thank you so much for the time this afternoon. I know it's been a long day for you, so I will try to be brief with my comments. So my name is Larry Gluth. I'm the president and CEO of the Bobby Dodd Institute. We're based here in Atlanta. Our mission is to empower and employ people with disabilities, not only across the state of Georgia, but we also work in Tennessee, Alabama, and Florida. But the vast majority of our work is done across the state of Georgia. We employ more than 300 at contracts through the Ability One program and some of the social enterprises that we operate. But what I'm here to talk about specifically today is the cut in DBHDD funding. So we were part of Category 4. Basically the category where services were not being optimized or underperforming. And so what's being proposed at this point in time is $1 million cut on that line item for us. That contract originally was $4.25 million. So the math is 23.5%. And so far greater than the 4% budget cuts that the governor has suggested. I'm a veteran of a lot of tough budget discussions through my career, so I'm certainly not afraid of having a tough discussion around budgets, but I think anytime you review budgets, anytime you're considering cuts in services, it's important that all the facts are there as well. And so the primary reason that has been purported by DBHDD is that, again, we were not utilizing all of these funds, and our run rate essentially was significantly under what they anticipated us to be at the end of the year. One of the things that we did as an agency, so we kind of inherited these programs in our merger with All About Developmental Disabilities 2 years ago this month. Part of what we really needed to do when we brought them into the fold was to look at the program delivery. And quite frankly, it was something that I wasn't entirely happy with. And so we made a lot of changes in leadership. We did a lot of training of the folks. all along the way, we kept our partners at DBHDD informed. And I do want to say we've had a wonderful working relationship with the folks at DBHDD. They are our partners. They're an important partner. And we try to keep a very open line of communications going. So we let them know that we were going to be running, a little bit under what we had anticipated while we got everybody through the process of training, better management, better people on board. Happy to say that we're through that cycle at this point. And so if you look at our run rate and go back 13, 14 months, you'll see it's probably well underneath the trend line, and they probably were thinking they were justified in taking $1 million cut. But one of the things we continued to reinforce with them was that you really need to look at what we're able to do from a service delivery perspective over the last 2 or 3 months. We've essentially doubled the amount of work that we've been doing around intensive family support. And so we would be very close to kind of what the original contract was. And so I'm here today to advocate for getting a little bit of that money back. Not the full $1 million, but if we could get half of that back, it would really allow us to do the work that we had anticipated doing this year. I was a little surprised in hearing that there were no service cuts anticipated as a result of these cuts. There are. Clearly there are for us. Today, BDI is servicing roughly about 400 families through the Intensive Family Support Program. And if you take $500,000 or $1 million out of that, there's no way that we can continue to serve that number of individuals, that number of families. And so, that's important. The other thing that's really critical here is that there are another 400 families who are on the waiting list. And we had really anticipated, as we developed, continued to develop our capacity and our capabilities, that we were going to be able to make a dent in that waiting list of 400 families. And, that's totally off the table at this point. That is not going to happen. So we clearly want to be able to serve those families. We want to be able to serve those individuals. And a lot of the programs that are part of, the services that are a part of the intensive family support, I think it's important to note that many of these services are they're contracted out to independent contractors. So they're therapeutic services for the most part. They might be camps, they might be swim lessons, they might be some other type of therapeutic program that is helping people with intellectual and developmental disabilities. It's a really critical part of their overall service package. And so when we cut those services, it has a real impact on people's livelihoods. Many of those service providers that we contract with are small, independent operators. We're cutting into their livelihoods as well. So when you consider a $1 million cut to our budget, to that one line item for us, it might be easy to say, well, it might be a few people out of their staff, there's probably less services, but I just want to reinforce that it has a downstream impact as well. There are real jobs and real economic impacts as a result of that. Many of these funds are reinvested back into the community. So I appreciate your time, and I'll just open it up if there may be any questions.
Any questions? I think we visited this afternoon,
Yes.
and members of the committee a few years ago did visit Bobby Dodd, and so we were able to see some of the good work you were doing. So thank you for being here and
Thank you for
sharing
your
that
time.
with us.
Thank you, Representative Dempsey, Chairman, and members of the committee. I'm going to part two from my dialogue yesterday, and I have a little bit of a handout that I wanted to pass out, and you can. I think today's presentation by Commissioner Fitzgerald, who we all so much respect, and They do so much important things at BHDD, but for me, it raised a lot more questions. And one of those questions is, we've got cuts in the amended fiscal year 20 budget for supported employment and education services. Now, I work with folks like Larry in all of the different agencies that do VR. And my advocacy is more around these other cuts in BHDD for supported employment and education, because while they say they're underutilized, I've just got a big question is, why would they be underutilized? People with disabilities are still struggling to get employment. People with mental health conditions and substance use disorder conditions have one of the biggest hurdles, especially if they've had incarceration on their record. So I'm just really wondering how that is underutilized. I mean, we've got people that we know are waiting to get into services. We've had the problem in VR. You heard about that yesterday. And we've got these dollars in BHDD for supported employment and education, both for adults and child and adolescent for mental health. And I'm really like questioning how in the world could these services be underutilized? So that is a question I bring to you. I have no answers, but I think that's something that you might all want to look into. The other thing that is really a very disconcerting, and I don't represent anybody in the substance use disorder field. I have been an advocate in that area for a long time. I don't have any clients there, is that residential program. I find it really tough that, as I talked to you about yesterday, when we squeeze the balloon at one end, it bursts somewhere else. We're putting 40-bed forensic unit in at BHDD, and we're taking money out of accountability courts. We're taking money out of residential programs that didn't get started. So what does that mean to folks in the future? I mean, it usually means incarceration. We have to serve them in our prisons. We have to serve them in the more difficult areas, and I think it means homelessness. So I just want to bring that up. It's like, why did programs not get started? And could it be that we're not really thinking about how we're funding the more expensive programs in this budget and keeping people out of institutions, keeping people out of psych beds? I'm really nervous that we're redirecting money from those community-based services, that $8.3 million in behavioral health and that $14 million in child and adolescent. Really, I hope that you all will examine that, because if we're paying for more expensive services somewhere, somehow, someone's not going to get served. I mean, that has got to be the bottom line, is psych beds are expensive. Crisis is expensive. Community programs are much more cost effective. So if we're taking money and redirecting out of those programs, I think you were getting to that answer. If we're serving 1,000 people in community services, can we really be serving 1,000 people in crisis and in psych beds? So I just had a lot more questions. I know behavioral health is doing the best that they can do. As you said, Chairman, they were given an order to basically find money to cut. So you all have to really dig deeper and figure out, how is that going to really impact that balloon down the road? If we squeeze it on one end, is it just going to burst out and we're going to have more people in our jails and homeless?
Are there any questions or comments from the committee? Thank you.
Thank you very much. We appreciate you so much.
Oh, you do? Okay. Okay.
We've been dealing with the issue of homelessness in my community. I mean, literally the main street that I'm off, and it's still not a main thoroughfare. And we've called lots of different agencies in DeKalb County. Yeah. There's nothing they can do about it. They're allowed to sleep on the street. I've had neighbors that have tried to work with them, tried to offer them this and that. It's all no, no, no. But in the meanwhile, we have, the blue top and other things that are just collecting on the sidewalk. You look in the woods a little and you see something. And we're told by the commissioners, by other folks, there's no laws in place.
Yeah.
Homelessness is becoming a much bigger problem than it's ever been. And we say, well, thank God we're not homeless. Yeah. But what we also have to realize is, maybe we're not, but someone else is. And indirectly, it has an impact on us. It has an impact on our communities, on our neighborhoods, and also how or who or what or where?
You know, you bring up a really good part, Representative Henson, because when Commissioner Fitzgerald showed that trajectory of community growth and services over the last decade, that is remarkable for adult mental health programs. In substance abuse, in addiction, we have almost flatlined. When I look at the budget, and I'm literally, you know, I've been analyzing the budget for a long time, we had 48 million in adult addictive diseases in FY 2009. That budget was cut to 40 million. It has only grown to 58 million over this last decade. So we are now cutting 5 million from that budget, which brings it back down. I felt we were on the verge of addressing, especially in Metro Atlanta, that residential need. And now, even if we partially looked at implementation, and I don't know all of their plans, we've got to invest in addiction treatment. We really, really do.
I don't know if all of this is addiction, Dawn, or if some of it is homelessness due to some other reason.
Veterans.
Yeah, and
we have a lot of veterans. Yeah. So it's again, it's that balloon. It's like we don't have the services the community supports, and so those folks are homeless. They're in DFACs if they're children, and they're in prisons. Yeah, we've got to address it somewhere. Thank you.
Thanks.
Yeah.
Well, thank you, and thank you for being here today.
Thank y'all.
All right, one more presenter who I fear came all the way from Albany to talk to us and has been here all day long. Thank you so much.
Thank you for hanging in there with me today. It's been a long day for y'all, I know. So, yes, thank you for allowing public testimony and for us to be here today, and thank you for hanging in today. I know it's late. Be short and sweet, hopefully, and we can all head home. My name is Deanna Julian. I'm Executive Director for Albany Advocacy Resource Center and Albany ARC. We've been serving individuals with disabilities in Southwest Georgia since 1963. Our great works continue in the legacy of our previous director, Ms. Annette Bowling, whose unwavering dedication to civil and human rights and of people with developmental disabilities is well known to many in Georgia General Assembly. Albany ARC continues to support over 700 people with disabilities in Southwest Georgia through 4 different Medicaid waiver programs. And when you talk about cutting, it's very difficult to see how services are not going to decrease when you're cutting budgets. We serve people through the Now and Comp waivers, ICWP, SOURCE, Aging and Elderly Disabled, not to mention, when you asked about contracted services, several state DBHCD and GVRA funded programs are supported by Albany ARC. We have Project ARC, which is case management services for individuals to live in the community and access community services. Our Kids Corner Child Development Center, early intervention services for children with autism and developmental delays. Mental health, case management, treatment court, substance abuse court, that was Judge Goss's program that Victoria Dariso now runs, and vocational services in support of employment. This funding is crucial to the true survival of people with disabilities that we support and that of their families. Yet in this political climate of proposed significant budget cuts, Georgia currently has over 6,000 people on the waiting list for services for developmental disabilities. The proposed cuts on top of funding reductions from recent years will leave families with nowhere else to turn. As a result, while the weight of employment in our nation is on a rise, the National Alliance for Caregiving and AARP report 6 out of 10, 61% of caregivers experience at least one change in their employment due to the needs of a loved one with a disability, such as being late, having to go on medical leave, reducing their hours, take a demotion, turn down a promotion, or eventually giving up work completely, which affects our economy and our taxes ultimately. Without formal funded supports for the loved ones with a disability, the earning ability for caregivers is negatively impacted, as well as their ability to be contributing tax-paying citizens. Caregivers suffer loss of wages, health insurance, and other job benefits. Programs provided by Albany ARC and similar agencies are creating solutions for families and caregivers to maintain employment, provide community integration, and much-needed medical assistance to those they love and support. They simply cannot be cut. When you talk about providing mental health and keeping people out of crisis, providing the supports families need to give their loved ones care is crucial in keeping people out of crisis and out of mental health centers. One thing that we continue to look at is the compound issue. Last year there was a House study committee on the direct support professional workforce crisis, which ultimately was left unanswered to some extent. Those challenges still face Albany ARC and all providers that support individuals with disabilities on a daily basis. Over the years, with changes to the Department of Labor laws, such as companion sitter changes, salary thresholds we just incurred in January, and increasing liabilities, it becomes more and more difficult to meet the ever-demanding need of employments and staffing for the people we support. Albany ARC currently supports 117 people in our residential program, with a need to have almost 300 staff to cover those shifts. Our overtime average is about 5,000 hours per month, which annualizes almost $1 million increase to our budget. Albany ARC has supported individuals with 24/7 supports to live independently in their own homes for over 30 years, which has always been the goal: real homes, real jobs, and real independence. Albany ARC and all providers cannot survive with continued cuts while maintaining the cost of providing quality supports to individuals and families in our communities. Lastly, Albany ARC also has a Child Development Center for Early Intervention Services for children 18 months to 4 years old with developmental delays and autism to prepare them for mainstream education. This is one of the first programs started in Albany ARC. It's one of the only like it besides the Marcus Institute. In the past 35 years, through this funding, we have supported over 750 families and students. In 2017, we doubled the number of children we serve and continue to maintain a waiting list of over 25 students per year. We are the only early intervention program south of Macon. Many of our families fall well under the poverty level and do not have the means to travel to the Marcus Institute nor to Macon to get the level of intensive support needed to support their children. Albany ARC currently supports 40 children and families free of charge with behavior therapies, social skills training, and we contract with occupational therapists, behavior therapists, physical therapists, and speech therapists, which are all billed through Medicaid. Those are independent contractors that bill their own Medicaid, to provide needed services for the development of our children to prepare them for mainstream education. Out of the 40 children we serve, several are already diagnosed with multiple disabilities and will not be taken by your typical daycares, which leaves already struggling families having to lose an income to stay at home with their children. Our support teams follow children through their first year of public education and assist with the transition into pre-K or kindergarten. Over the years, we have seen children exiting our program perform better academically, maintain behaviors, and have increased coping strategies due to the early intervention supports they receive from Albany ARC's Child Development Center. The late Senator Greg Kirk understood the importance of this value and initiative in Southwest Georgia and assisted in funding an extra $220,000 for this program. This funding is pivotal to the survival of early intervention services in Southwest Georgia. We hope you're in agreement that this program is crucial to families, but most of all the children we support. We are asking you to support these programs and continue to support DBHDD's and Commissioner Fitzgerald's dedication to supporting and creating a continuum of care for people with disabilities across Southwest Georgia. And again, I thank you for your time and staying late with us today. We do appreciate you.
Oh, we appreciate you. Thank you. You are exemplary. I'm well aware of the great work that has always gone there in Albany. Are there any comments or questions?
Did you take the position that Annette had had?
Yes.
Very big shoes.
Very big shoes to fill. I had red shoes on yesterday. I was told I need to get red fingernails, but yes, very big shoes.
I just know of the program over the years of having known her. She was just an incredible lady.
Phenomenal advocate for people with disabilities across the years. And we hope to continue her legacy.
I'm sure you will.
Thank you
so much.
Thank you.
Thank you so much. Safe travels. And,
Thank you.
Thank you for the work you're doing, particularly. Okay. Y'all all have amazing muscles to stay here this long, not only the members here from the House, but all of you that are out there. Thank you so much for staying with us. This will conclude today's business, and we'll adjourn our meeting. Thank you.